Have you ever wondered about the right time to start certain health checks, especially as you navigate different stages of life? It is empowering to know when to begin proactive steps for your well-being. For cervical screening, which typically involves a Pap test or Pap smear, the recommended age to start is generally 21 years old. This guidance comes from major health organizations, and it is a key part of preventing cervical cancer. The reason for starting at 21 years old, regardless of when sexual activity began, is rooted in the understanding of how cervical cancer develops. Cervical cancer is almost always caused by a persistent infection with certain types of human papillomavirus, or HPV, in younger individuals. HPV infections are very common and often clear up on their own without causing any problems. Screening too early can lead to unnecessary tests and procedures for changes that would likely resolve naturally. By waiting until 21, doctors can more accurately identify cell changes that are more likely to progress into cancer, balancing the benefits of early detection with avoiding over-medicalization. So, how can you put this information into practice? If you are 21 years old or older, schedule an appointment with your healthcare provider to discuss cervical screening. They will confirm your specific screening needs based on your individual health history. It is also important to remember that these screenings are usually recommended every 3 years for women between 21 and 29 years old, if results are normal. After 30 years old, depending on the guidelines and your specific risk factors, your doctor might recommend a Pap test combined with an HPV test every 5 years, or continue with a Pap test every 3 years. An interesting detail about modern screening practices is the concept of co-testing. This means having both a Pap test and an HPV test done at the same time, which offers a more comprehensive look at your cervical health, especially for those 30 years and older. This combination approach helps detect abnormal cells and the underlying viral infection more effectively. The guidelines for cervical screening have evolved significantly over the years, becoming more precise to maximize benefit and minimize harm for everyone. Regular cervical screening is a simple yet powerful tool that offers vital protection for your long-term health. Understanding when and why to start these screenings and adhering to your doctor's recommendations allows for early detection of any potential issues, leading to successful treatment and providing you with peace of mind.